Very much. Maybe even a little bit. Check evidence. Good evening, everyone. Yeah. Good evening, everyone. Yes, the hush has come. Feedback. Welcome to the White Coat ceremony at the Virginia Tech Freeland School of Medicine, the class of 2028. I would like to, yes, indeed. I would like to thank all of the family members and friends who are joining us this evening, your student, as well as the faculty and administration. Really appreciate your being with us for this special occasion. Together, we have been looking forward to this event in which our exceptional students in the class of 2028 formally make a commitment to the career of care and caring in medicine. At the outset, I'd like to recognize some of our leadership groups within the organization. I saw you kind of mingling with them before. These folks will play a very important role in the growth of our students over the next 4 years. Scattered throughout this auditorium, some dressed in white, some dressed in their street clothes, our chairs, deans, and selected members of the faculty and staff. Will all of our team members please stand? Not all at once now. Thank you for being here. Thank you for being there. We're glad you were able to join us this evening. Well, next, Dr. Amanda Murkison, our incoming Associate Dean for Student Affairs, will join me here at the podium to explain the history of the White Coat ceremony and share a little bit about the class of 2028. Dr. Murkison.
Thank you. The first White Coat ceremony was held at the College of Physicians and Surgeons at Columbia University in New York in 1993. It was inspired by the vision of Dr. Arnold P. a professor of pediatric neurology at Columbia, who was concerned that students were losing their connection to the human element of care. The purpose of this ceremony is to clarify for students that a physician's responsibility is to both take care of patients but to also care for patients. providing a ritual to mark the passage of the students into the medical society as old as the Hippocratic Oath itself. But Dr. Gold felt it important that medical students should be provided with well-defined expectations and responsibilities appropriate for the medical profession early in their education prior to contact with patients. This is what inspired the Arnold P. Gold Foundation to advocate and sponsor the white coat ceremony, now held annually at most medical schools in the United States. In this ceremony, the white coat becomes not only a rite of passage, but a symbol of the profession itself. So as you have your freshly ironed, very pristine white coat placed on your backs today, please let it remind as the first step in your journey to becoming a physician, and also a reminder of the responsibility to the health of our patients. The class of 2028 white coats have been donated to your class by Dr. and Mrs. Richard Wardrop through a grant that they provided. The Wardrops are graduates of Virginia Tech, and Dr. Wardrop was on the faculty at Virginia Tech Carilion School of Medicine as the school was envisioned and started. He recognizes the symbolic importance of this event and wanted me to welcome you into this honorable and most human of professions. The 36 women and 15 men who make up the Virginia Tech Carilion Class of Medicine 2028 and who will receive their white coats today represent 51 incredibly bright, accomplished, and motivated students. It came from a pool of 5,800 applicants and 289 interviewees. The class represents 19 home states and 15 who call Virginia home. They attended 43 different undergraduate schools, including 4 from various campuses of University of California, 6 from the University of Virginia, and 2 from Virginia Tech. 14 have already earned a graduate degree. What brings them together is their common desire to become the best physicians they can possibly become. It is that desire that has attracted them to this unique and challenging curriculum offered by Virginia Tech Carilion School of Medicine. They are here tonight to publicly state through taking an oath and the symbolism of the white coat itself that they are committed to the next important step in their quest toward becoming worthy of the title medical doctor. Dean Learman will now introduce our keynote speaker.
Thank you very much, Dr. Murkison. It is now my distinct pleasure to introduce tonight's keynote speaker. Each year, we seek to identify a white coat speaker who has distinguished themselves as an exemplar of humanistic practice. This year is certainly no different. Dr. Tony Sapal is the Chief Physician Executive of Carilion Clinic and a Professor of Emergency Medicine at VTC. Dr. Sapal comes to us from the University of Arkansas for Medical Sciences, UAMS, where he was the Executive Associate Dean for Clinical Affairs and the Stanley E. Reed Endowed Professor and Chair of Emergency Medicine. He held numerous clinical and academic leadership posts in Arkansas, including Chief Clinical Officer for the health system, Director of the Emergency Medicine Service Line, Chief of Staff, and Chair of the Hospital Medical Board. As our Chief Physician Executive, Dr. Sapal oversees Carillion's large physician group. This multifaceted role comes with a robust set of responsibilities, expanding access to care for patients in Virginia, West Virginia, and North Carolina on the one hand, as well as advancing research and education in collaboration with us at VTC. Dr. Sapal is nationally recognized for his expertise in evidence-based medicine education, as well as the application of science to healthcare. He is an elected member of the Board of Directors of the Association of Academic Chairs for Emergency Medicine and is a fellow of the American Board of Emergency Medicine. Dr. Sapal graduated from the Honors in Medical Education program at Northwestern University in Chicago, where he was inducted into the Alpha Omega Alpha Honor Society. He completed his residency in emergency medicine at Carolinas Medical Center in Charlotte, North Carolina, where he also served as chief resident. And as a committed lifelong learner, Dr. Sapal recently attained his master's degree in healthcare delivery science from Dartmouth University. Since joining us last year, Dr. Sapal has impressed me as a visionary and collaborative leader rooted in the values of humanism, compassion, curiosity, and accountability that epitomize the best qualities of practicing physicians and physician thought leaders. Please join me in welcoming our keynote speaker, Dr. Tony Sipal, to the podium.
Good evening. I said good evening. It's a party, right? We're going to celebrate tonight? All right, so Dean Learman, thank you so much for that introduction. And I think after hearing all of that stuff about me, you're probably expecting something profound and meaningful. You will, maybe. But I do believe if you don't, there are drinks and food afterwards. So there's at least something else to look forward to. But before I get into my prepared remarks, I want to share a story with you all because my wife said that I should, because we need to kind of maybe you'll find this funny, maybe you won't. And so, as you heard, I trained at Carolinas Medical Center, which is about 2.5 hours from here. And in my third year, I was a chief. And for some of my colleagues to my left or your right, the chairs and some of the senior faculty, they will remember a time when you were a resident and you pretty much ran the show because the faculty had better things to do. And so one evening at Carolinas Medical Center, I was working in what we call ER Major, which is where all of the really sick, especially trauma patients, come through. And on that specific night, I was working with one of my classmates and colleagues, Ben Brieger. I'll never forget his name because he was just kind of a strange guy. But with 2 third-year residents in the department, the attending physician showed up and said, "I'm out of here." And I don't know where they went. But we ran the department that night. And lo and behold, it was busy and we're running around taking care of a lot of patients. And in comes a trauma 1, which is the highest level of trauma designation. We were a level 1 trauma, level 1 burn center. And this was an unusual case. So a gentleman was at a bar. I know this sounds like a setup for a bad joke, but this is actually true. He was quite intoxicated. Walking to his car, he tripped and fell in the parking lot. No big deal, except for the fact that in this parking lot, there was a piece of rebar sticking out through. Oh, you know where I'm going with this, right? But not yet. No, it gets a little better. So as it turns out, he fell in such a way that the rebar hit him in the face, right in his right eye socket. So I don't want to gross anyone out, but this person was whisked to our emergency department. I was the resident in charge of the evaluation and management of this patient. The trauma team had not arrived. I think they were in the OR. They were busy. And Ben Brieger, for whatever reason, he was kneeling at the side of the bed, helping the nurses put an IV in. And I immediately realized that this gentleman suffered an injury that could have resulted in him losing sight in his eye. So for our medical students and physicians, it appeared he had a retrobulbar hematoma. His eye was proptotic, which means it was kind of protruding a little further than it should. The problem with that is that the optic nerve, which connects your eyeball to your brain, is very sensitive to changes in pressure. And so if that pressure is not released quickly, you could lose vision and the eye deteriorates, et cetera. So it's pretty clear to me that I needed to perform a procedure called a lateral canthotomy, where you essentially incise some ligaments around the orbit that then allows the eyeball a little bit more room so that it's not being pressured by this growing hematoma. So I calmly told the nurse, I need some lidocaine, a 27 gauge needle, an iris scissors, and a clamp. And without hesitation, Ben Brieger looks up at me and says, "Hey, Tony, have you ever done that before?" And I responded right away. I said, "No, but I did sleep at a Holiday Inn Express last night." So I share this story for a couple of reasons. Number one, you're first year medical students and you're just beginning your journey. What you will see along your path is that you will get better and better. And I promise you, I got better as a physician shortly thereafter and then beyond. But medicine will also throw you curveballs that you're not going to expect. And while you will always do your best, sometimes you just have to include a little bit of humor to get through your day. And that actually did lift the feeling throughout the room. I performed the procedure, and just to get to the end of the story, as it turns out, He didn't need the procedure because this rebar somehow had clipped his entire optic nerve, so there was no way to save his eyeball anyways. So I couldn't mess anything up. Really, the moral of the story is sometimes, it doesn't matter how good or bad you are, it's just better to be lucky. And indeed, I was that night. All right. Well, let's get to the meat of this discussion. I want to first, again, welcome all of you, family members, the class of 2028. My goodness, I do want you to know that I was your age once. So just realize that one day you will be this old. And 2028 just seems like so far off to me. To my fellow chairs, esteemed colleagues in the School of Medicine, Dean Lehrman, and all of the staff that helped put this night together. This has been absolutely wonderful. So I am honored to be here for this pivotal moment in your lives. We're not just celebrating the hard work and sacrifice that got you here, but the beginning of a lifelong journey into the medical profession. I also want to recognize all of the individuals that have helped you earn admission to this wonderful class of future physicians, many of whom are here in the audience tonight. And for me, that includes my family and someone I won't mention in my speech until right now, and that's my wife, who has been my bedrock and support system for the last 35 years, married for 27. But I know for many of you, this isn't just another step in your career. You're fulfilling a calling driven by a passion for caring. I felt that way too when I stood where you are now. I know my oldest daughter, Savannah, felt that way when she first donned her white coat 3 years ago. And I'm hopeful that my youngest daughter, Taylor, will get the same chance that you have tonight as she pursues her own calling in medicine. I want to share with you what I would tell my own daughters about what putting on a white coat really means. It's not just a symbol of a degree, class credits, or even your sacrifices and accomplishments. This coat is an emblem of service, empathy, and dedication to your patients and the communities you will serve. When I was in medical school at Northwestern University, we used to have coat hierarchies. And interestingly enough, spontaneously, we had a conversation about this just 5 minutes ago or so before we started. Students like you wore short white coats. That's what I wore while I was there. Residents wore blue coats. Attendings had long gray coats. And the only people that could wear long white coats were department chairs or the dean of the School of Medicine. If you saw someone in a long white coat, you knew instantly they were really important and you should probably get out of their way. But similarly, patients are going to see you in a white coat and they will immediately trust you. I can't think of any other profession in which so much trust is placed in a person just because of a title, much less because of the coat that they wear. They are going to trust you with the most intimate details of their lives, and you will care for them when they are often at their most vulnerable. It doesn't matter whether you have earned that trust or not. Just think about the power that you will have in that moment with someone that you don't know and they don't know you. They will see you in that coat and they will instantly think that you and your words are important. So celebrate today, but remember with this coat comes much responsibility. Every time you put it on, let it be a reminder, not just of your expertise, but of your empathy and the responsibility you have to care for each patient with thoughtfulness and respect. Additionally, today if you become leaders in your community, whether you want to be a leader or not, your role will always extend beyond the walls of any clinic or hospital. At Carillion Clinic, our mission slogan is to improve the health of the communities we serve. It's a quote you will see and hear often. Our job isn't just about caring for patients, but advocating for a healthy community for all of us to live, work, and play. Don't forget that also includes taking care of yourself and your colleagues. As a physician, you will have influence, and it is your duty to address disparities when you see them and advocate for initiatives that create a more just and equitable healthcare system. You are a critical voice for ensuring that every person, regardless of their background or their zip code, has access to the care that they so richly deserve. It doesn't matter if you are working in an operating room or volunteering at a free clinic, your role as a leader in the community begins today. And even if you move away from the bedside, even if you retire, hang up your white coat, you will still retain your title and people will still call you doc. You're going to hear it. Hey, doc, how's it going? Hey, doc, I got a question for you. And I know firsthand your family and friends will call you out of the blue and ask questions about their ailments or their medications. It's already, see, I can tell it's already happened. It will continue. Trust me, it will never end unless you're my wife, who's not a physician, who is actually the doctor in the house, or so I've been told. But you will probably have to hear more than once about your cousin's weird toe fungus or your neighbor's hip surgery. But don't take their respect and admiration for granted because you've earned it, and remember what they see in you as a leader and as a professional. After all, the power of being a physician is beyond what you do on any given day. It's more than the coat. It's a call to action. It's being a leader. It's improving the health of your community. When we met last week, me and the class, I was asked what advice I would like to pass on to you, and I couldn't stop at just one. So needless to say, I've got more than just one piece of advice for you tonight. So while I've mentioned a couple of things in this speech so far, I want you to remember the following that should always be part of who you are, because I believe it's always part of who I am. The first is to be humble, because you should always be a servant leader first. And as much as medicine will change you, remember that you have the power and duty to transform healthcare. You will be the change agents of the future. Don't forget to love. Love yourself, your family, your friends and colleagues, and especially the noble profession you have committed to excel in. And finally, find joy in the many relationships you will form as a physician and what the profession of medicine will allow you to do. So congratulations to all of you for completing the hard work it took to get here. I look forward to watching all of you grow into future leaders of healthcare, and whom I will proudly call colleagues and hopefully friends. Thank you very much.
Well, that was just wonderful, Dr. Supal, and I really appreciate your inspiring and thoughtful words and compelling stories from the front lines of medicine. They provide important insights about the meaning of our lives in medicine. They're as relevant for all physicians as they will be for our students throughout their careers. Well, there's much to celebrate today, and we hope that each of our students will take a deep breath, appreciate the importance of this moment, and feel the joy of this occasion. We also hope that your sense of celebration and meaning will transcend today and accompany you like the coat through your careers in medicine. So wearing a white coat means many things to our patients, as you've heard and thought about, and to the health of our community. During your PAMI course, you began to reflect on these identities that define the patient-centered physician, the scientist physician who bridges the gap between bench sciences and patient care, the systems citizen who considers the holistic needs of patients, communities, and health systems to achieve the best possible outcomes, and the lifelong master adaptive learner committed to ongoing personal and professional development. So beyond those general identities that we've shared with you, that we're to nurture in you over the next years, at the Virginia Tech Carolina School of Medicine, it's been our tradition for each class to develop a shared set of guiding principles that you create and make commitment to. These principles will act as a compass for the class to follow during medical school, throughout their residency training, and throughout the arc of their careers as physician leaders. I'd like to introduce you to the class of 2028 President and Vice President, Hiam Betis and Kate Watkins, who are going to read the class's guiding principles. After that, Dr. Rebecca Pauley, our Vice Dean, will lead us together in reciting the Hippocratic Oath. May I call upon our President and Vice President, class of 2028, please come up to the podium.
Virginia Tech Carilion School of Medicine, class of 2028, brings together diverse talents, backgrounds, and experiences. We are united by these guiding principles. Community. We strive to make each other better in all our academic and personal pursuits. We face challenges together and encourage each other, fostering a safe community for our peers and patients alike. We represent the entire medical school to our neighbors. We pledge to uphold the values of service, inclusivity, and respect in all the places where we work, live, and learn.
Visionary. As future pioneers in the medical field, our class is driven by a commitment to intellectual curiosity and the advancement of patient care through innovation and inquiry. We seek to not only adapt to healthcare's evolving landscape, but also actively shape it. We do not shy away from challenges, but view them as opportunities for growth and motivation to continue developing novel solutions. We strive to lead, engage, and collaborate within our communities to create an environment of excellence that utilizes everyone's unique expertise.
Integrity. As aspiring physicians, we strive to embody integrity in day-to-day interactions with our patients, peers, and communities. We have the courage and conviction to stand up for what we believe is right. We are committed to providing the highest quality of care for those we serve. We practice humility, put our patients first, and maintain integrity above all else.
Advocacy. We have a moral obligation to advocate for ourselves and others. To honor this, we dedicate ourselves to upholding social justice reform and health equity, while simultaneously breaking down barriers to healthcare. We stand by this commitment to our patients through active listening and thoughtful questions, while adapting our approaches to account for their unique needs, priorities, beliefs, and cultures. Equally, we will leverage local resources and health policy to better serve and educate our patients. We strive to empower our patients and their families with the ability to advocate for and actively participate in their care.
Humanism. Our patients' autonomy, dignity, and well-being are at the nexus of our endeavors. We seek to uphold these core tenets of patient-centered care. As future physicians, we strive to preserve the humanistic values of our profession by recognizing patients for their personhood, acknowledging their lived experiences, and treating each person in our community with empathy and respect. Regardless of the situation, we honor the trust in our profession as a beacon of hope and a support system for humanity. As members of Virginia Tech Carilion School of Medicine, we commit to embodying the university motto, Ut Prosim, that I may serve.
Thank you so much for sharing those very heartfelt and inspiring words. In our profession, it is a custom established more than 2,000 years ago that no one may be admitted to its honors who has not first expressly undertaken its obligations. In a moment, we will take an oath that in its original form was written by Hippocrates. Ours is a modern version of that oath written so many years ago, but it's certainly applicable today. As the students prepare to recite this oath together, let us take a moment of silence to each humbly acknowledge all those who have come before us and have dedicated their lives to this noble profession, and to the people it serves, and to all those who have taught, supported, and encouraged us in order that we could reach this present moment. And to all those, in particular, our teachers and our patients, who will help us become physicians of excellence in care and caring. Let us pause. And now, in that same spirit, let us together, all physicians in the audience, whether faculty or family members, along with the students of the class of 2028, stand and recite the oath. You will find this in your program. I swear to fulfill to the best of my ability and judgment, and with the support and encouragement of others, this covenant. I will respect the hard-won scientific gains of those in whose steps I walk, and gladly share such knowledge as is mine with those who are to follow. I will apply for the benefit of my patients all measures appropriate, avoiding those twin traps of overtreatment and undertreatment. I will practice the art of medicine as well as the science, remembering that warmth, sympathy, and understanding may outweigh the use of scalpel or drug. I will not be ashamed to say I know not, nor will I fail to call in my colleagues when the skills of another are needed. I will remember that I do not care for a patient alone. Rather, I'm part of an interprofessional team, all of whom offer their skills, assist with patient care and caring. I will respect the privacy of my patients, for their problems are not disclosed to me that the world may know. Most especially must I tread with care in matters of life and death. Recognizing this awesome responsibility must be faced with great humility and awareness of my own frailty. I will remember that I do not treat data or disease, but a sick human being whose illness may affect family and economic stability. My responsibility includes these related issues if I am to care adequately for my patient. I will prevent disease wherever I can, for prevention is preferable to cure. I will remember that I remain a member of society with special obligations to all my fellow human beings, those of sound mind and body, as well as the infirm. If I do not violate this oath, may I enjoy life and art, respected while I live, remembered with affection thereafter. May I always act so as to preserve the finest traditions of my calling, and may I long experience the joy of serving those who seek my help.
Hey, as the students prepare to receive their white coats, I would like to take this moment to explain the coding process to all those in attendance. When their name is called, each student will come up the stairs on this side with their white coat. They will be coded with their white coat, symbolizing the embodiment of these values as they set forth on their next stage of their professional development. On the lapel of their coat is a pin from the Arnold P. Foundation, which contains the words, "Keeping Healthcare Human," reminding all under their care that the wearer is committed to providing medical care that is compassionate as it is high quality. In the pocket of each coat is a note of encouragement from one of our past graduates. They will then proceed to the table to my left and sign the Virginia Tech Carilion Medicine Oath Book on the next available line. This is an acknowledgement of their commitment to the words and the spirit of the oath that you just took. As you leave the stage, Dr. Holt Forrest will give you a gift from the Humanism and Medicine Club. This gift is a book written by one of our own class of 2026 students, Stigna Nadapati. So let's begin the ceremony. Sanvi Acharya. Hila Akula. Shi Ambakar. Egina Anambotla. Betis. Jade Bajic. Owen Ball. Donna Barbaro. Claire Barton. Karen Bauer. Colin Burns. Shu Chaudhry. Kerr Chenault. Kristen Colizzi. Braden Copeland. Amanda DeGraff. Emily Duggan. Austin Fitzgerald. Christine Flora. Jason Getker. Estrel Green. Brendan Hammond. Hanlon. David Hess. Miriam Iqbal. El Jella. Sandra Kaiser. Lee Krebs. Rohit Kumar. Elizabeth Kunst. Samuel Lindsay. Angela Mack. Colby Mallet. Tara Maynon. Camille Mittendorf. Victoria Osinga. Regan Parker. Jordan Peck. And Phillip. Lindsay Porter. Amanda Reynolds. Alexander Robbins. Thea Roche. Peter Scroll McLaughlin. Scott Summelsberger. Lynn Stiller. Linda Tucker. Neil Tyler. Kate Watkins. Rebecca Worthington. Shell Yoon.
Okay, well, on behalf of all the physicians here today, it is with great pride and abundant expectations that I formally welcome the Virginia Tech Hurlian School of Medicine class of 2028 to our profession. Will the class please stand and be recognized? All right, please be seated. Thanks again to all of our guests for joining us tonight, witnessing the oath that our class has taken, and promising to support them in the challenging and fulfilling odyssey that lies ahead. This time, I would invite you to make your way through the side doors of the auditorium, but ask that the class of 2028 remain where you are for just a few minutes so we can get a group photo. Good night, everyone.